you a little story. So it's a story about a little boy. His name is Jimmy. He's 13 years old. He lives happily with his parents and family. One day he decided to learn skateboard, but unfortunately he broke his leg. So he goes to the hospital to get his leg fixed. While he's at the hospital, he suffers a lot. So the doctor prescribed him some painkiller, like codeine, for example. And he gets used to it because it appeals the pain. He feels better. So later, when he comes home, whenever he feels a bit bad or he's hurt, he asks his mother for some more recovery. And a few days later, he is a painkiller addict, like 12% of the American adults. The painkiller addiction has been on the rise this past 2 decades. It's not because it's popular, it's just because of the availability has risen in the past few years. In developed countries, the doctors are becoming more and more lenient. They prescribe it for almost everything. Like, if your legs hurt, to get painkillers, your stomach hurt, to get painkiller. If you're depressed, to get painkiller. If you just go and get painkiller anyway. So they give it for no reason, really. The reason is because there's a lot of groups that they are called pain advocacy group that just state that a patient from the doctor should not suffer any time. If you go see a doctor and you suffer after this, the doctor is wrong. That's what I mean. So the patient really asked for it, and the doctor they don't have a choice. Painkiller is nowadays second only to marijuana in popularity and second to none in availability. How it works, the painkiller basically it fixes itself to the brain receptor. It forces a release of dopamine, which decreases the pain felt by the brain. It's not just on the body, it's on the brain. So it's necessary to make the difference between an addiction and dependence. Physical dependence, it's mainly a body state that you tolerance and withdrawal. I mean, you get used to it, but just a dependence. Whereas an addiction is a compulsive use of a drug that produces harm or dysfunction, and the continued use of the drug despite that dysfunction. This was in the National Vital Statistics System website in 2008. So I just wanted to make clear that dependence is not synonym of addiction. It's one in the body, one in the brain. So we will see the symptom first, then the causes, and the recovery process. For the symptom, the most visible one is a mood swing, like you're very happy for an hour or two, and then you become depressed, and then happy again, and depressed, happy, depressed. Your mood swing between the two states all the time. You complain about everything, like it's too hard, it's too cold, it's too lazy, I'm not doing too much work, whatever. You complain about everything basically, and the appearance, you neglect it, you don't feel like taking care of yourself. You go over here, you dress with the same dress every day, do the same clothes every day. Another symptom is expectations. You detach from reality, from everything, from family. So you're in decline, your physical ability is in decline because you don't move a lot, you don't go to sport, you don't work, you don't take the bike. Drowsiness, that's when you lose your attention, you lose your focus very easily, you get bored of everything, just want to sleep, and when you stop time, because you don't do anything, the time passes very slowly, and because it passes slowly, you don't keep track of it because you don't need it, because an hour seems like a year, so there's no point keeping track of it. First symptom is, I think, the most visible one. Yes. Painkiller addiction in the US. There is, in 2008, 12% out of 100,000 died of overdose in the US. So that may not sound like a lot, but it's only due to painkiller. Actually, we can read this one. For one die or one death, there is 10% who are being treated for abuse, 32 who are in emergency got an emergency visit to the hospital for abuse or misuse of a painkiller, 130 people that use it but don't get any following from doctors or not treated for this. 825 use painkiller non-medically. I mean, they just take it because they want it. Just because they feel bad or because they have scratch their knees, their knees, for whatever reason. I think this statistic. Then substance abuse and mental health service administration. It's the main result. It's an American organization. No, say what this addiction can do. We will see the causes. I mean, what leads to this addiction. As I stated in the introduction, it's the availability is the main factor. There's 1,800 doctors in the US only that prescribe painkiller regularly, as been daily, prescribing for anxiety. They don't, it's not because the patient asks it, they just prescribe it because it's easier for a doctor, because they get paid for each person they see, so they just prescribe painkiller, get to the other one. So it's a 5-minute business. They can increase their incomes very easily like this. In fact, the production of the United States, production of painkiller, 2010 was enough to give every American adult painkiller for 24 hours, 24 for 1 month. That means you can give them painkiller one after one for 1 month. I'm sure another reason is predisposition. The first one is genetic. Is some people that carry not a disease, but genetic predisposition to painkiller. I mean, they have more effect on them. They have more euphoria than they should, so they become addicted to the feeling. 1 out of 10 American is genetically predisposed to painkiller. The other cause is environment, close relative. Like people who take painkiller usually recommend them to their family or their friends or their children, their parents. Like, for example, if I take painkiller because I got back pain, one of my friends said he felt stomach pain, I will just give him my painkiller. He will start using it, and he will start recommending to his relatives too. The rate of people using painkiller is growing exponentially each year. Every people who use painkiller, every person who uses painkiller, give it to his relative, then give it to his relative, and give it to his relative. So it's going very, very fast. Second one is imitation, like children who sees their parents using painkiller usually end up using them. The last one is reckless medication. Like a protective mother give them to their children when they feel they start at a very young age, sometimes 8. So just to our brains not developed to reduce the effect of painkillers. When we see the causes, we'll see the way to recovery. So how you can recover, basically there is no psychotherapy, no real psychotherapy to get rid of painkiller addiction. There is only medicine. People painkiller or medicine, they are meant say. It's limited to craving for 24 hours. So if you can make it once a day, you can reduce your painkiller consumption to 0 in 24 hours. Because you have no need for it anymore. But the problem is that you need to take the medicine at least once a day for it to continue. And it's only available through specialized clinics. The buprenorphine, it imitates what the painkiller does. It's fixed to a receptor to release dopamine too, and it prevents the painkiller from doing so. But the high is lower. It means you don't get as much euphoria, but it helps you reduce your consumption. And the more you take, even if you take all the buprenorphine, you won't get more of the high. So there is no point in taking more. So you don't increase the dose. The last one is naltrexone. This one is FDA approved. That means it's scientifically recognized as a painkiller. It's multitask. So you can use it for alcohol addiction too, and several minor other addictions. The most present effect is the side effect. So there is nausea, diarrhea, stomach pain, drowsiness. So a lot of people are that it's almost the same as taking the drug itself. So to conclude, although treatment exists for this addiction, it's continuing to raise especially every year. Addicts tend to give money to their relatives, so that's why it grows all the time. The number of people using grows all the time. There is no specific reason at cause. I mean, it's not the doctor's fault, it's not the patient's fault. There is no regulation for this. I mean, there is regulation, but it's not applicable by law. The only way to stop this would be to educate the people using it. That pass from the doctor. They should tell their patients when to stop taking painkiller and stop